I'm Dr. Jesse Alba. I'm a board-certified pediatrician and a fellow of the American Academy of Pediatrics. I work with Alpine Pediatrics in Orem, Utah. So there's several different stages of child development. When you go to take your new child to the pediatrician's office, typically as a pediatrician, we're going to be asking you what your child is doing. At 2 weeks, they're not doing very much. Typically, they're going to be maybe starting to smile just a little bit at you, but typically not going to be interacting a lot with you. They're pretty sleepy. They're going to wake up to eat and poop and sleep again and all that kind of stuff. By 2 months, however, children wake up a little bit, and I'll often tell families that they can expect a child to look right at them, to respond to them, to smile at them. Maybe a little bit of cooing, little oohs and ahs and goos and gaws is pretty normal to see. The question people ask me a lot is, when should I be nervous about my child's development? And that can be very difficult. There's a lot of good resources that you can use if you go to healthychildren.org. That's a website run by the American Academy of Pediatrics. It talks about normal developmental stages. Also, a good conversation with your pediatrician is going to be key. Things that would be concerning to me: a child who is now 9 months old and not rolling over at all, that would be very unusual. Typically, children are rolling by 4 to 5 months of age, and I'll usually give them to 6 to 7 at times. But by 9 months, if they're not rolling over, that's concerning. By 15 months of age, if they're not walking yet, that's typically very concerning as well. And it may be a normal developmental delay for them, but it may be a sign of something else going on. Language development is a really important one to watch, and that starts slow. By 9 months, your child's babbling, starting to make some mama dada sounds. By 1 to 3 words. At 15 months, 4 to 5 words. At 18 months, 8 to 10 words. So if I have an 18-monther come in who's not even saying mama dada, that's pretty concerning to me. Typically, I'm going to look for that by about 15 months of age, hopefully much sooner. If you have concerns about your child's development, the best thing you can do is get them into your pediatrician, have a full evaluation done, talk about it, see how they're doing. It's very easy to compare your child to other children that you may know, and a lot of parents get worried about that. If all of their cousins are walking and they're 10 months old, but theirs is not walking yet and they're 13 months, that may be developmentally appropriate for that child. The best thing you can do is get in and chat with your pediatrician.